Down syndrome is a genetic condition in which a person has 47 chromosomes instead of the usual 46. Down syndrome symptoms. Down syndrome symptoms vary from person to person and can range from mild to severe. However, children with Down syndrome have a widely recognized appearance. The head may be smaller than normal and abnormally shaped. For example, the head may be round with a flat area on the back. The inner corner of the eyes may be rounded instead of pointed. Common physical signs include decreased muscle tone at birth, excess skin at the nape of the neck, flattened nose, separated joints between the bones of the skull, sutures, single crease in the palm of the hand, small ears, small mouth, upward slanting eyes, white, short hands with short fingers, white spots on the colored part of the eye, brush field spots. Physical development is often slower than normal. Most children with Down syndrome never reach their average adult height. Children may also have delayed mental and social development. Common problems may include impulsive behavior, poor judgment, short attention span, slow learning. As children with Down syndrome grow and become aware of their limitations, they may also feel frustration and anger. Many different medical conditions are seen in people with Down syndrome, including birth defects involving the heart, such as an atrial septal defect or ventricular septal defect. Dementia may be seen. Eye problems, such as cataracts. Most children with Down syndrome need glasses. Early and massive vomiting, which may be a sign of a gastrointestinal blockage, such as esophageal atresia and duodenal atresia. Hearing problems, probably caused by regular ear infections. Hip problems and risk of dislocation. Long-term, chronic, constipation problems. Sleep apnea, because the mouth, throat, and airway are narrowed in children with Down syndrome. Teeth that appear later than normal, and in a location that may cause problems with chewing. Underactive thyroid, hypothyroidism. Down syndrome treatment. There is no specific treatment for Down syndrome. A child born with a gastrointestinal blockage may need major surgery immediately after birth. Certain heart defects may also require surgery. When breastfeeding, the baby should be well supported and fully awake. The baby may have some leakage because of poor tongue control. However, many infants with Down syndrome can successfully breastfeed. Obesity can become a problem for older children and adults. Getting plenty of activity and avoiding high-calorie foods are important. Before beginning sports activities, the child's neck and hip should be examined. Behavioral training can help people with Down syndrome and their families deal with the frustration, anger, and compulsive behavior that often occur. Parents and caregivers should learn to help a person with Down syndrome deal with frustration. At the same time, it is important to encourage independence. Adolescent females and women with Down syndrome are usually able to get pregnant. There is an increased risk of sexual abuse and other types of abuse in both males and females. It is important for those with Down syndrome to be taught about pregnancy and taking the proper precautions, learn to advocate for themselves in difficult situations, be in a safe environment. If the person has any heart defects or problems, check with the physician about the need for antibiotics to prevent heart infections called endocarditis. Special education and training is offered in most communities for children with delays in mental development. Speech therapy may help improve language skills. Physical therapy may teach movement skills. Occupational therapy may help with feeding and performing tasks. Mental health care can help both parents and the child manage mood or behavior problems. Special educators are also often needed. Down syndrome is a common disease, yet every individual needs unique treatment and care. We encourage people with Down syndrome and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about Down syndrome and how to treat Down syndrome, just click on the link at description or visit www.mainmd.com. Thank you.